yourself to everybody. Tell everybody who you are, what you do, and the relation of that to epilepsy.
Okay, so my name is Georgina Gillard. I am a student at Midway School of Pharmacy, hopefully graduating very soon. My father is epileptic. He has been for a number of years, and this has essentially made me very interested in epilepsy. And as you know, people are probably aware through the social media pages, obviously they initiated the SP study, which we carried out at university. And as a result of this, when I do graduate, I'm going to specialise in epilepsy and be an epilepsy specialist pharmacist.
Oh, that's great news. Just a quick one. I don't think most people don't know about the study. So if you could just go over that a little bit, just say what it was about and the purpose, just the 30.
Okay, yeah. So essentially in your master's year, you have to do a research study. So myself and my colleagues, we decided to do the study called the SP study, and essentially was establishing the pharmacy role for people with epilepsy. Because essentially we know that community pharmacists are the most accessible healthcare provider, and we want to know what we can do to help people with epilepsy. And it was very, very helpful, and as a result of that, it's kind of like helps me to, you know, identify areas of where pharmacists could potentially improve in the future.
Great, because obviously when one has epilepsy, you're getting drugs on a regular basis.
Yes, exactly.
And depending upon the person, like some people get it sent to their homes, it all depends. But like I see my pharmacist a lot, really cool dude actually. But I'm lucky that I can sort of manage my medication myself, generally speaking, I take what I want. Some people, everyone's different. And I think lots of people need a bit more help from their pharmacist, ideally. So that's kind of where you come in, is it? Where you are going to come in?
Yes. So I would like to prescribe. So that's one thing I would like to do. And what actually stimulates me into this is that unfortunately we don't have like much specialist epilepsy care around here. And what I have noticed, obviously I have worked in quite a few areas, is that it seems like in terms of it's GPs as well as some pharmacists, not everyone, because you do have some absolutely fantastic people out there, and I absolutely love the pieces. But because is that they're a bit scared to talk about AEDs or talk about epilepsy, and I think the most important
anti-epileptic drugs, by the way, everyone. Sorry, just to stop. And
sorry,
AED stands for anti-epileptic drugs. Yeah. Okay, sorry, carry on.
No, that's okay. No. I just think it's like to get over the stigma. So, for example, there's a lot of people think in terms of levetiracetam, which is one of those anti-epileptic drugs. A lot of people think you're going to become very, very aggressive with it.
Known as Keppra, people, just people out there, so you know that's the long word for Keppra. Okay.
Yeah. And so essentially a lot of people think, some people do think they become very, very aggressive with it, although like it's something that's very rare and it's very effective for some people. And I think the most important thing is to identify how as pharmacists we can help in terms of people with epilepsy. You know, so sometimes it's all about honesty, because sometimes, you know, you ask someone, oh, how are you today? They'll be like, oh yeah, good. But then obviously when you actually get into that chat, they'll be like, oh, actually I keep forgetting to take my tablet in the morning. And so it's just things like that. And hopefully, you know, in terms of helping in terms of people taking the medication, that can potentially help their seizure control. And I think honestly, just talking about taboo subjects as well. And I think if people get to open up, hopefully,
yes,
and they can get a lot more out of us. There's a lot more to us than just dispensing medicines.
Well, and that's, I think we need to not just be able to have people recognise that, but well, we can't have people recognise it if it's, first of all, it's not actually the case. Well, I don't think with all pharmacists, is it? Like, some are like nuts, like it's like they're on a constant wheel. But maybe there should be extra time for them to spend with epilepsy patients. Is that the case? I mean, how would that come into place with pre-existing pharmacists who already got their hands full?
So what seems to be is coming into practice now is something called a hub and spoke. So what that basically means that you have one big warehouse that does only have robots in there, and that dispenses, you know, picks the medicines and it gets sent over to these community pharmacies. And so as a result of this introduction, it's starting to allow community pharmacists to have more of a service provision. So it's more of taking away the dispensing role out of this and actually providing more services and using our clinical role and essentially be able to, integrate ourselves a lot better into the healthcare system.
When is everyone going to be able to do that then?
So some have already started. So, for example, Lloyd's pharmacies, they've already started their such as hub and spoke mechanism, and so they're also going to try. The government is now trying to pass it through legislation so that independent pharmacies. So what I mean, like, say if I was an independent pharmacy, would be like if someone just bought a pharmacy themselves or trying to run it themselves, and so they're getting those together and doing the same mechanism as well. So it is becoming more of a common thing. And so as a result of that, pharmacists will now become more into a service approach, which I think is a lot better for the future of pharmacy.
And we have a lot of people tuning in who are not from the UK. So I just want to be careful that you're speaking about the UK only at the moment. Is that correct?
Yes.
Okay, cool. Does UK pharmacists learn much from those from overseas? Is there quite a bit of sharing of information, or I don't mean personal information. I mean,
I would say so. Yes. Yeah, in terms of the techie stuff. So, in terms of this hub and spoke idea, I think it did originally come from like some EU countries have started doing this as well. So yes, it is in terms of the pharmaceutical side of things. A lot of information is shared amongst the EU, and yes, granted, some countries are more developed than others in terms of the pharmaceutical world. But by actually sharing this information is the reason why, essentially the UK have started doing this hub and spoke approach using the robotics and allowing community pharmacists to have this more time to, speak and engage to all sorts of patients, including people with epilepsy.
Cool. So if people want to get hold of you and learn more about what you are doing and what a pharmacist can do or should do, I don't know, how would they do that?
Okay, so I still need to make my Twitter page, I have to admit that, but I do have my Facebook page, which I will kind of like tag in. Alternatively, I could drop in my emails. Would that be okay with people?
Well, do you know what? We're going to put this live on
social media.
We're going to put this on YouTube tomorrow, so you can send me contact details then if you want, and I can attach it to the bottom.
Yeah, cool.
You there. All right, thank you so much for your time. And have a nice, relaxing evening. Good luck with the studies.
Thank you. Bye.
Bye. Bye.